Today we're going to talk about what symptoms and circumstances you can look for to figure out what's causing your child's ear pain and what you can do about it. There are a lot of different reasons for having ear pain, and depending on the character and the location of the pain and the circumstances that preceded it, we can often determine the cause and therefore the solution. This is going to be part 1 of a 3-part series on ear pain. So if your child is having ear pain and you're not sure what to do about it, then you've come to the right place. So let's get started. So for each of these reasons to have ear pain, we're going to cover 4 different topics. 1. What causes the ear pain for each disease process? 2. What's the typical course of events? In other words, what's the triggering event that leads to the ear pain? 3. How do you manage it at home? And when do you bring your child to the doctor? And 4. What can you do to prevent it? Okay, so let's start by talking about a source of ear pain that's at the top of everyone's mind in the summer, and that's swimmer's ear. So what causes the pain that you get from swimmer's ear? Swimmer's ear is also called otitis externa, which basically means inflammation of the external part of the ear. What happens with otitis externa is that there's fluid that gets trapped in the external ear canal. The ear canal is what we call a blind-ended pouch. This means that the canal is kind of like a straw, where the other end of the straw is completely blocked by the eardrum. When you get swimmer's ear, water or fluid gets trapped inside that straw and can't drain out, often getting trapped behind earwax. When the water sits on the floor of the canal, the skin starts to break down. What it looks like is similar to what happens when you wear a Band-Aid for too long, and when you take it off, the skin looks kind of white underneath. A similar thing happens inside your ear canal. Your skin has keratin that forms a waterproof barrier, which is why you don't absorb water when you go swimming. But that waterproof layer has its limits, and eventually it starts to break down if it's exposed to water for too long. When that happens, the skin cells start to slough off and break down. When those broken down skin cells continue to sit there on the skin surface inside the ear canal, it starts to get inflamed, and inflammation is painful. So the way this typically develops is either by recurrent exposure to water, maybe summer camp or swim team, or maybe it's just a single exposure leading to water that gets trapped behind some retained cerumen. It often starts with mild ear pain and either scant fluid that dries out on its own, or more copious fluid and pain that continues to progress, often waxing and waning over several days. One red flag that your child has swimmer's ear is that it's painful when you manipulate the outside of the ear, either pulling on the top part of the ear, called the pinna, or pushing on the area just in front of the ear, called the tragus. This is referred to as tragal tenderness, and it's pretty much diagnostic for swimmer's ear. So why does this cause pain? Because movement of the pinna or the tragus causes deformation of the canal. It pulls on the skin, and when the canal's inflamed, that's painful. So what do you do if you think your child might have swimmer's ear? So the first thing we'd want you to do is to make sure that they're not continuing to make it worse. At the very least, we want them to stop getting it wet until the pain is completely gone. The next thing we want you to do is to do a hydrogen peroxide flush. Now, I know I told you in my last video the top 5 things your doctor wishes you would stop doing for cuts and scrapes, but this is the exception. This is an appropriate use of peroxide on people. So the benefit of the peroxide is that the bubbling action can help to dislodge and flush out the sloughed off skin cells in the canal. Removing those broken down cells can help to decrease the inflammation inside the ear canal. Some people find the bubbling action of the peroxide to be too much. If your child is one of those people, an alternative might be to use white vinegar. White vinegar can help to reacidify the canal to the correct pH, which is designed to be just slightly acidic. I usually have people do these peroxide flushes or drops twice a day for about 3 days. And if they're still having pain on day 3, or if the pain is getting worse instead of better, even on day 2, to have them check in with their pediatrician to consider a prescription ear drop that usually has both an antibiotic and a steroid in it. So what can you do to prevent swimmer's ear? The best way to prevent swimmer's ear is to keep the ear canal from trapping water. If your child is on the swim team, or you just got a pool, or you're visiting grandma and grandpa at the lake, this might be a good time to start thinking about prevention. At the end of the day, before going to bed, you could just put 2 to 3 drops of rubbing alcohol in both of their ears. This helps to dry out any retained fluid that's trapped in there. Another thing you can do is just take your hairdryer and wave it across their ears. Again, before bed, just to help the rest of the fluid dry out. I just put your other hand next to their ear just to make sure you're not directing the hot air in any one spot for too long. You can try either option, but for younger kids, I definitely lean towards the rubbing alcohol, just because kids have ear canals that are narrower, obviously, but also they're more tortuous than adults. And both of these anatomical differences make it more likely that they're going to trap fluid in their ear canals, and also make it harder for the hot air from your dryer to get to the back of the canal to dry out any water that's back there. So, pro tips. 1. The peroxide shouldn't hurt. It should actually be soothing, which is probably something you're going to want to tell your child before you come at their painful ears with the peroxide. 2. Eyedroppers can be great for this application, but if you don't have one, you can use a small spoon or the cap, or if you like, you can wash out your Tylenol or ibuprofen medication dosing syringe and use that. 3. The peroxide doesn't have to sit in the ear canal for a very long time. In fact, it's probably going to work best if they start to tip it out in the middle of the bubbling stage when the skin cells are more likely to be suspended in the fluid. 4. Rubbing alcohol is great for prevention, but you definitely don't want to use it after your child has started to have ear pain. It's probably not going to help, and it will definitely hurt, and any future eardrops you have to use will involve a lot of wrestling. So remember, rubbing alcohol is for prevention, peroxide is for treatment. So that's it for swimmer's ear. Check in again next week to find out what you have to know about the next 2 common sources of ear pain. And as always, remember that the best way to take care of your kids is to take care of yourself. See you next time. There are a lot of different reasons for having ear pain, and there are a lot of different reasons for having ear pain.